Welcome to the Spen and Nick Show. This is our second business model breakdown show, and today we're going to be looking at Babylon Health. Now, if you're not familiar with the business model canvas, you can check out our previous video where Nick does an incredible 90-second overview of all of the sections of the business model canvas. Go check out that video. We're not going to go into the detail of that now. What we're going to do is we're going to jump straight into the business model canvas that we think Babylon Health has, or maybe they don't have. We've kind of dissected and reverse engineered their business model to figure out what we think their canvas could look like. So Nick, why don't you get us started on the business model canvas for Babylon Health?
Perfect. Let's get into it. So again, this might not be perfect. It's very quick. It's very dirty, but hopefully it's going to help you understand the business much better in a very quick and hopefully under 5 minutes. So let's look at the customer segment. The customer segment, well, now really the target is the mass market. They're looking to try and help as many people as possible. And it's interesting because Spencer, you were saying that you've been reading Crossing the Chasm recently. Do you want to talk about that, and then I'll give a response as well?
Yeah, and in the essence of speed that we're going for, I'm going to really quickly highlight what the Crossing the Chasm is all about. Essentially, it's about the diffusion of innovation. Essentially, how you get technology out to really big markets and how big companies, big technology companies win. Now, initially, you want early adopters and innovators to take on board your products. These are people that are really forgiving. They really want new pieces of technology as quickly as possible. Then you need to get into the majority, which is the area that we're talking about, the mass market. The big problem that you have is jumping over that massive gap from those early adopters and innovators into that kind of mass market population, the people that are a little bit slower to adopt technology. Crossing the Chasm is what that book is all about. Some amazing stories in it, but I'm really interested, like, who were their early adopters? Who was their innovators? Are they past that now? Are they actually going for the mass market? Or, where exactly are they, Nick?
Well, yeah, I think they are starting to go past that now, and they are starting to go for the mass market because they're starting to move into China, into Saudi Arabia. They've got contracts in Rwanda and Canada as well. And they're also going, they've started in their main base in London, which was Fulham and Hammersmith. And so their first early adopters were, well, tech-savvy young Londoners based in Fulham and Hammersmith. That was the first kind of target customers that they went for. And now they're certainly expanding beyond that. So that gives us a good idea, a good description of the customer segment, I think.
Absolutely. And what's really key with this is they've gone after a market who are both really into technology, but also probably quite influential around technology with their friends and family. So what they would hope, I'm sure, that part of this strategy is to get people to really love those tools, really love that technology. And then they'll start sharing it with their friends, which means that they can start to get people following those early adopters and then getting into that mass market. So a really great strategy.
And it was really interesting because I saw this really good interview with Ali Parser, the CEO. And what he was talking about was that the value, he didn't say this was the value proposition, but I heard him say what he's trying to do is have the healthcare you need on the device you have. And that, to me, I was like, that's their value proposition. That is the clear benefits that you'll get from using their service. So that's their value proposition, and there's more to it. It's basically affordable healthcare for everyone. That's what they're trying to offer here. And then the channel that they do it through, well, mainly through their app. There are other ways of doing it, like through their, I think they've got their chat, online chat service on their website, I think, as well as possible. But it's mainly through the app, right? And then you've got the customer relationship. Well, it's interesting because you described it as this. I wouldn't have thought of it this way. But what did you call the customer relationship, Spencer, when we talked about it earlier?
Well, I talked about it as a B2C to B company. So in other words, you've got a difference between the buyer, the people that you're getting money from, and the people who are the kind of beneficiaries of the product that you've created, or in this case, the actual app that you've created. So the beneficiary, that's the C, that's the customer. That's the people that are the kind of end user. But the B end of this, in terms of the customer relationship, are businesses that are kind of paying for users to use it. And of course, we'll go on to the revenue streams, but the main contracts we think at the moment is the NHS, because they're delivering kind of NHS type services through through their technologies. But we'll come on to the revenue streams in a few minutes.
Definitely. Actually, let's move on to it now. So the main revenue stream, if we talk about it, is, well, it's free. Like you can put that as a revenue stream. Like it's free for the user. So we said B to C to B. So for the main user, the consumer, it's free. But then what's being paid for that, or because it's B to C to B, the organisation that's paying for it is the NHS through that contract. So that's the revenue. Like that's where they're getting their revenue from, being able to do this as well. So let's talk about the key resources now. So the key resources, like there are many, but I think one of them is the data that they're going to collect and the opportunities that offers them. So for example, they could be able to create new businesses out of the data that they've got from all the patients they've been able to interact with. So that's a huge opportunity. And as you mentioned when we were talking before the video, that could create fantastic revenue streams in the future. And then let's talk about the network of healthcare professionals as well. They need to have that, otherwise this isn't going to work at all. And they're doing some really interesting things where they've got, I don't know how it works exactly, but on the app, what they've got is lesser trained staff answering a lot of the kind of simpler questions, and that are being supervised by more well-trained doctors. So I think that's quite an interesting thing that helps scale this phenomenally well. And then you've got the key activities. So it's interesting because they're almost more of a tech company than a healthcare company, right? And so one of the key things they're doing is managing the technology. And so that's very different from what the NHS is typically doing, or it's also their approach is very different because of that kind of philosophy that's different there. And then we've got, the key partners. Or actually, no, let's go to the cost structure. So the cost structure is that of a tech company because they are more like a tech company, right? So they've got all those tech costs that are going to be coming up. And then, of course, they've got the doctors' salaries as well, and also just general staff salaries. So those are the main costs. And then they've got partners, and this is probably one of the most important things, and definitely key partners. Key is the right word here. In the UK, they couldn't do this without the NHS, right? They couldn't do it without their support. So that's a huge partner. The doctors, that they need support with, they need to partner up with them to enable it to happen. And actually, as I mentioned, they've got a contract, they're doing some work in China, and they're doing that through the WeChat app. And so that's one as well that's going to help them get to the mass market as well. So hopefully that gives a good kind of summary or overview of the business model. And we were talking about it as well, like I say, just before the video, and you were like, Spencer, you were saying that this helped you understand it pretty quickly without really much background, right?
Yeah, I've heard of Babylon Health, but I've never looked into it. I've never downloaded the app. I've never used it. But actually just doing this and this little bit of dissection and the kind of research work that you did really help paint the picture of what it is that they're doing in a really, really good way. I think the value proposition is fantastic. You can see how beneficial this is going to be for everyone, actually, for all of those key partners, for all of the different end users. Super beneficial. If you think of just the NHS perspective, hopefully this enables more efficiency. Hopefully this enables better productivity and doctors doing stuff that really matters rather than some of the things that maybe don't matter quite so much. You can see how beneficial this could be across so many different areas. Really interesting one. I am definitely going to watch and pay really close attention to the progress for Babylon. They already seem to be smashing it way beyond the UK, which is all news to me as well. So really, really interesting case study.
Cool. Brilliant. So should we leave it there then this week?
Absolutely. Let's do it. So look, we've done now 2 of these. I think 2 officially makes it a series, right? So we've got this new series now of looking at business models, and we're calling it Business Model Breakdowns. If you want more of these, if you're getting some good benefit from it, we've looked already at a direct-to-customer relationship one last week. We've looked at a B2C to B proposition this week. Maybe we'll do something completely different next week. If you want some more of it, let us know. Like it, share it, comment, all of that great stuff that we really appreciate. Anything else to say, Nick?
Now, I'm looking forward to seeing your beautiful faces next week on the Spen and Nick Show, where it will be episode 43, I believe. So I'm looking forward to that.
We're getting close to that 50 mark. Let's see if we can push on and do it soon.
Cool. See you later, everyone.
See you later.